So today's topic is about fetal alcohol syndrome. There are different types of fetal alcohol spectrum disorder, and fetal alcohol syndrome is the one we are focusing on today. There are also two other types. One is alcohol-related neuron development disorder, which is normally in your nervous system. People who have this will have intelligence issue and disability on learning and solving problems. So the other one is alcohol-related birth defect. It's mostly physical structure, for example, a problem with heart, kidney, even bone structure. So fetal alcohol syndrome. This kind of disorder is not because victim him or herself do some not really healthy try, but because their mother. When child exposed to alcohol during pregnancy, well, they will get this. The cause of people like baby child who have like different facial feature that was kind of weird is because they exposed to alcohol during the first 3 months during the pregnancy. One of the result of fetal alcohol syndrome. Drinking alcohol anytime during pregnancies can cause irreversible damage. For example, certain nervous system problem, low birth rate, and behavior issue. So let's go down to the cellular level. You know that people's cell membrane cannot stop acyl alcohol. This means as soon as alcohol gets into your blood, every cell will be affected. Of course, mostly brain cell. We'll explain that later. So, cause of brain damage and growth issue. Single organ damage, heart defect, kidney dysfunction, brain damage impact on wide range of things. And even though the problem caused by those are varies to different people, but the problem have one common, that is, as soon as it being caused, it will be irreversible, at least now. So, according to an experiment, which they use rat and mouse, pregnant one, and feed them alcohol. Kind of cruel, but people do that for science. So they actually found out developed neuron commit suicide, or say in a more scientific way, appetizes. In a mass scale, remember, mass scale. Okay, so recent study has shown it happens in many brain regions, plus spinal cord and retina. Those are very important part of neuron system. Axon disturb synaptogenous NMDA. Pronunciation issue, please ignore it. I will show the picture later so you can search it on Google by yourself. And NMDA glantamate and GABA receptor. They will send signal to your cell, develop neuron, and then develop neuron will appetize. Boom! So to brain, we know that neuron cells come together forming neuron tissue, and neuron tissue work together to form neuron organ, and multiple organs work together to create a system. So if it have basic effect on neuron cell, well, it have effect on neuron system and then neuron organ. So this means neuron system and brain will get irreversible damage just because the cell did. The brain will become smaller compared to the normal one. The FAS, fetal alcohol syndrome, person's brain actually are smaller and have less curve and even smoother than the normal one. What do you think that will cause? Well, poor balance and conditioning, disable on intelligence, disorder on ability to learn, and even delay development, For example, problem like hyperactivity, which is the one that child cannot control their movement and move a lot, and defeat on memory. You will have rare temper and speech impairment. So that's all the psychologically, mostly brain damage. Now we'll talk about physical defect. When I said physical, it means something you can see from the outside. For example, just as I said before, distinctive facial feature caused in the first 3 months when you drink alcohol during pregnancy. So child will have like small eyes and an expansion seen upper lip, a short upper nose, and a smooth skin surface between the nose and upper lip. This trait is called fetal trimming. Hard to pronounce, and I do not even think I pronounce it right. This is biology. Welcome to the world of biology. They have so many terminology that it's hard to pronounce, and even though they have a more simple meaning and a more easy way to say it, people just create those words. Okay, and also they have a small head because they have a small brain, so it makes sense. And they will have low body weight. So even though FASD cannot be cured, at least now, it actually have many treatments to help the victim grow their full potential. Early diagnosis may help reduce the defection and learning difficulty and behavior issue. So as soon as you become parent or yourself as a victim notice that you have this, quickly communicate with the doctor. Early as you could, you may have a better chance to improve more. So early intervention service, it helps children from birth to 3 years old to learn important skills. This service includes therapy that will help the children talk, work, and interact with others. So protect factor. It is the things that help to reduce the effect of FADS and help people who have it reach their full potential. So there are some protect factors. For example, early diagnosis. It gives more understanding on why sometimes children act or react differently, for parents, of course. And involvement in special education and social service. It can help people to find out their child's special needs and learning system, which increase their potential and percentage to reach their full ability. And loving, nurturing, and stable home environment. Children with FADX actually are more sensitive than normal ones. And this can help them and prevent them from secondary condition, which may lead them to crime and violence. So also absence of violence, prevent them from secondary damage. And there are some medication that could help. Well, at least now no medication can treat it. But there are some medications that serve to help some special part, which every medicine have a side effect. And then when they say medicine can fix some problem, it actually causes more problem. So stimulate, used to treat symptoms such as hyperactive, problem paying attention, and poor impulse control. Antidepressant, used to treat symptoms such as sad mood, loss of interest, sleep problem, school disturb, negative irritable aggression, and neuroleptics pronunciation issue, please ignore it. Used to treat symptoms such as aggression, anxious. Anti-anxious drug, used to treat symptoms such as anxious, just like its name. And this is the one we are going to focus on. These things used to treat symptoms of anxiety, but it causes more problem that make people more anxious, which is kind of ironic. Some have more effect than others, just like some are stronger than others. This is medicine. The one we'll focus on is called bimethyldiazepines, chemical compound. Search online on Google. And there are some examples of it. For example, acne, eczema, hypertension. Okay, those are some problems that it will cause. Hypertension, it was actually known as low blood pressure, and inertia, feeling like disgust. Well, some people said that the food I cook can actually cause this, which I don't believe it at all. And lack of conditioning and ambition, depression, wear temper, memory loss, and decay IQ. C. This habit and depression, wear temper, and lack of condition. There are some active factors, and those factors are actually something that caused by FADS. So seeing all those factors, it actually made people feel more anxious instead of less anxious. Kind of ironic. So medication can affect each children differently. To find the right treatment, the doctor may try different conditions, so it involves parents. And if parents can understand their child more and willing to work with doctor more, their child may get a better chance to reach their full potential. However, not every parent willing to do this. This is my work citing. Thank you. This is the end.